Hi guys, this is Jody. I just pulled some slides together from ATI Farm Made Easy Module 2, which is the nervous system part 1. I know you have your handout to kind of help you go through the module as well. If you haven't already looked at that, I do encourage you to go through the module, complete all the activities, and look at the drug tables. The nervous system, when we talk about this, we're going to talk about two different systems, right? It breaks down into the central nervous system and the peripheral nervous system. In the peripheral nervous system, you have the autonomic nervous system, which includes that fight or flight. And then you have the parasympathetic, which is your rest and digest system. So neurotransmitters, we will talk about a little bit. They carry signals. Really, when you're looking at classes of medications, I'll show you on the next slide, it's helpful if you understand what neurotransmitters are responsible for. Now, this isn't a class where we're talking about just the neurological system, and, this should be something you've talked about anyway before and, other courses that you've taken, but it is helpful when you're looking at classes of medication if you understand what it is that neurotransmitters are doing. As you go into drugs, if you're giving an agonist drug, then it's actually stimulating a transmitter. We're stimulating a response. If we're giving an antagonist or a blocker, then we're trying to block that response of that neurotransmitter. So I pulled this table from nclexquiz.com. It's really a good table as you kind of go through and you see like what serotonin does. So what is the primary function of serotonin? Well, you see right in there that it includes mood regulation. So as we get farther into the semester, we'll talk about antidepressants, and you will see serotonin reuptake inhibitor drugs. So your SSRI drugs. So you see that serotonin obviously has impact on mood, right? So it makes sense that we would give that. When we talk about norepinephrine, this is the fight or flight response. We're looking at adrenaline, basically, when we're giving this. This is given in critical situations to help increase heart rate, vasoconstrict, and increase blood pressure. So again, you can kind of go through as we give drugs and you can kind of see what it is that neurotransmitters do and what their effects are. And then are we trying to block it with a medication, or are we actually trying to stimulate more of a response when we're giving a medication? So when we're giving drugs for the nervous system, we can give anything that's going to impact the brain or the spinal cord. So muscle spasms, seizure disorders, pain medications, drugs for anesthesia, attention deficit and hyperactivity disorder, Parkinson's, Alzheimer's, anxiety, muscle sclerosis, and migraines. We are going to, tap into what we are learning in this module because there is a part 2, right, that we'll talk about. So I am not going to read each thing that I have for you on these slides, okay? Because what I want you to get in the habit of doing is I can tell you that I print the drug sheets from each module in ATI. And then I go through and I highlight what I think is most important to know from those medications. Like what is standing out? What is a little bit different? What is going to key into nursing assessments and what I should be teaching a patient, right? So when a drug depresses the CNS system, you need to think of teaching to promote safety, such as avoiding other CNS depressants like alcohol and preventing falls and dizziness. So we would instruct a patient, if they're taking something that suppresses the CNS system, to change position slowly. Avoid operating heavy machinery like cars, okay? Baclofen, this is a drug that needs to be tapered to prevent withdrawal symptoms, which can be fatal. So that is something I definitely keyed into when I was looking at the drug sheet. Dantrolene, this one may be used for malignant hyperthermia. This would be something you might see if you are working in a PACU, with patients, surgical patients. You might be seeing something like dantrolene. medications for seizures. Phenytoin is a big one. That's Dilantin, if you've ever heard of that. This has a narrow therapeutic index. Whenever you see that, you should be thinking that we are drawing and monitoring drug levels. Because what does it mean when something has a narrow therapeutic index? This was in Module 1. It means that that dose that is therapeutic versus the dose that is toxic, there's just a very small difference between the two, right? So we need to be looking at the levels to say, are we giving enough of this drug for it to be therapeutic, but not too much that it's toxic? So we'd be looking at drug levels, okay? And then when you see things like that it's teratogenic, it means they shouldn't be taking it if they're pregnant, okay? Because it can cause birth defects. Now, there are some drugs that, you know, what they might need to do is weigh the risk benefit to the mom versus the baby for certain drugs, okay? For clients taking anti-seizure medications, implement seizure precautions. That would include putting oxygen at the bedside, suction at the bedside, removing any sharp objects from near around the bed. Some hospitals do bed padding, some others don't. It just depends. So you would look really at what are the seizure precautions for your particular facility, but having suction and oxygen at the bedside is always a good idea for somebody who has seizures, right? Instruct on fall precautions. And then when you see that a drug can suppress the bone marrow, like I have up here, you really want to watch for, so what does that mean? If it suppresses the bone marrow, we know that the bone marrow produces a very high percentage of blood cells for the body, including red blood cells, white blood cells, and platelets. So if somebody has a low red blood cell count because of bone marrow suppression, we would be seeing signs and symptoms of anemia, which could be increased fatigue, paleness, low blood pressure, dizziness. If somebody has a low white blood cell count, they're going to be more at risk for infection. So we would want to be teaching the patient to avoid crowds, make sure they're vaccinated, washing hands, you know, the things that we would teach to prevent infection. If their platelet count is low, they're going to be more prone to bruising and bleeding. So assessing for bruising and bleeding, that type of thing. So whenever you see that with a drug, those are the things you should be keying in on. So lorazepam is an anti-anxiety agent, but it may be given emergently for status epilepticus. So I did include that in here. So if you have somebody with status epilepticus, it means that they are continuing to seize. That is life-threatening. It is going to drop their oxygen level, and people can die from continual seizures. So we want to break those seizures, and so you will give IV medications such as diazepam or lorazepam. Valproic acid is a medication that you will see for seizures as well as for migraine headaches. A drug that you might see to support anesthesia is lidocaine. It does help with numbing. You will see the word pro-dysrhythmic on here. Lidocaine is actually a drug that you can give IV for a patient who has dysrhythmias. So I have given this for a patient who came in and had ventricular tachycardia. So, you know, we had tried amiodarone, it wasn't working, and so we switched them to IV lidocaine. Okay, when you give something to treat dysrhythmias, anti-dysrhythmics are also pro-dysrhythmics, which means we're treating these heart rhythms, but we can actually cause irregular heart rhythms as well. So that's what pro-dysrhythmic means. So we have to be very cautious with lidocaine because we can cause dysrhythmias. Let's see, it can be given again IV. It also can be used topically for numbing. Fentanyl is a drug that you'll hear a lot, often on the news because of overdosing and it being mixed into other drugs, and but it can be given safely in the hospital under monitoring at the right dose. It can treat pain. It can be given as an adjunct for like conscious sedation. So I have given it for conscious sedation along with midazolam, which is on the next slide. Whenever you're given an opioid, and fentanyl is an opioid, you should always have naloxone, that's your Narcan, available, okay? That will reverse the effects. So when we're giving an opioid drug, we should be looking at respiratory status, blood pressure, that type of thing. Now, again, fentanyl can be given, PO can be given IV. It also comes in these suckers. The suckers are more so used for patients like on hospice or palliative care for severe pain. Maybe it's pain due to cancer or something like that. They may be given suckers. There's also transdermal patches as well. Midazolam is another drug that can be used. This can cause memory loss or amnesia, and I have seen that with conscious sedation. When we give the midazolam, it's like people won't remember anything, from the procedure, even though we can wake them up during the procedure and talk to them, or they might be fully awake through the whole procedure, but they won't remember anything. Methotrexate sodium would be something you would see more or less if you worked in the PACU. I have personally never given this drug, but it may be something that you see if you are working in the PACU setting. Overdose can easily lead to death, so you'd be very much monitoring very closely a patient who is receiving this drug. Drugs for ADHD and narcolepsy. So amphetamines may be given. Amphetamines will stimulate. It's a stimulant, but it actually may cause more calming effects in some individuals with ADHD. It can disturb the growth pattern in children. So it can actually suppress growth, and it can lead to weight loss. And I have seen this with somebody I know who is on the medication, has a very hard time putting weight on because they take this medication for ADHD. So if you were giving this, say you were working in a pediatric office, you would want to be paying very close attention to the height and weight patterns of children who are on this medication. And it can cause high blood pressure, so you'd be checking blood pressure. And also you want, because it's a stimulant, you want them to avoid other stimulants like caffeine. And you would tell them to take this early in the day. Don't take it before bed because it's going to keep you up. Okay. Drug holidays are a good idea with ADHD medications. So they may stop the medications for a while. And again, with the Ritalin or the methylphenidate, it has on there to assess blood pressure. Therapy for narcolepsy and obstructive sleep apnea. I did tell you narcolepsy wasn't something I had thought too much about till my oldest went to college, and her college roommate had narcolepsy. And so she was on a medication like modafinil for that. Now, with somebody who is on this, it can decrease the effectiveness of oral contraceptives. So again, when you have women of childbearing age, if they're on oral contraceptives for the purpose of preventing pregnancy, then they should be using backup. And again, we would always encourage them anyway to be using condoms to prevent sexually transmitted disease. But if they're with one partner and, that's not something they normally do, we certainly want to encourage a backup medication. Sorry, I'm trying to get to the next slide here. Parkinson's. I think most people have heard of Parkinson's. You can look in Pearson if you want to read a little bit more on Parkinson's disease. There is an exemplar. The levodopa, carbidopa. So they don't have enough dopamine in their brain. The levodopa is the dopamine. The carbidopa helps the dopamine get to the brain. So basically, we're trying to stimulate or give a little bit more dopamine to the brain with this. Very short half-life, so they need multiple doses during the day. You want to make sure that they're not taking the doses with high protein foods. So let's say you have a patient that's been taking this medication and they don't feel like it's helping. So you as a nurse might assess, well, when are you taking it? And if they say, I'm taking it with my meals, you might want to say, well, what are you eating? Because if they're taking it with, say, their breakfast and they're eating eggs and sausage and having a big glass of milk, that's a lot of protein intake, and it's probably blocking the absorption of the medication. So it's really important to make those assessments. Are we seeing a therapeutic effect with that reduced tremoring? And if not, let's assess, when are you taking it? That type of thing. Another drug for Parkinson's disease, this one interacts with foods containing tyramine. And with that interaction, we can actually cause very significant hypertension. Just remember, when we can cause hypertensive crisis or severe hypertension, we put the patient at risk for stroke, right? So we want to be very cautious. So if you see things where a patient needs to avoid tyramine containing food, take a look at a list. Okay, foods containing tyramine. This is going to be your any fermented foods like your yogurts, your sauerkraut, soy sauce, sour cream, aged cheese, red wine, that type of thing. So you want to make sure that they're avoiding those things while they're taking this medication. You would also be looking at their blood pressure. Another one, this is going to decrease the CNS. So then you have on there their fall risk. Okay. Not going to read all of these to you. Alzheimer's disease is the disease that impacts memory. It is progressive, has different stages, and two of the big meds that you'll see for this are memantine and donepezil. You will see more drugs coming out for Alzheimer's because there's a lot of research going on, a lot of studies. So you'll always see new drugs coming out. But I can even tell you that Pearson keys in on these two drugs. There is no cure for Alzheimer's disease. So really what we're doing is trying to slow the progression of the disease. With the memantine, can watch for dizziness. If it's causing dizziness, we have to be thinking fall prevention, right? And they should be avoiding over-the-counter antacids. And with the donepezil, it does have a risk of bradycardia, so you'd be monitoring their blood pressure. And it also increases the risk for bleeding, so you want to watch to see are they on anything else that puts them at risk for bleeding, like anticoagulants, platelets, or NSAIDs, right? So we would want them to avoid those. Drugs for MS, interferon drugs we will talk about later in the semester again. These are pretty potent medications. They can suppress bone marrow. So again, we would be looking for signs and symptoms of bleeding, teaching on infection prevention, looking for signs and symptoms of anemia. These medications can cause flu-like symptoms as a side effect. So what we can do is instruct patients to take some Tylenol or acetaminophen prior to taking that to kind of minimize those effects. Can affect the liver, so we'd be looking at LFTs as well as the CBC, which will let us know if the bone marrow is truly being suppressed. Those are those things. Dantrolene, we talked about earlier. Monitoring LFTs, because especially women over 35 who are on estrogen are more prone to liver toxicity. Valproic acid, we talked about under seizures as well. This can be given for migraines. And then there's sumatriptan, or that Imitrex. I'm sure some of you have heard about that, can be given for migraine headaches. So those are the things that I pulled on those medications that I thought were really important. So hopefully looking at these slides, you guys will have the slides that you can look at as well as this video presentation to kind of look to see what I pulled. Again, I print out the drug sheets and then I highlight what I think is most important. And you should be getting to a point where, again, when you see things like bone marrow suppression, then you should be keying in on, if that is true, then I'm probably assessing the CBC, okay? And I should be teaching and watching and assessing for signs and symptoms of anemia, teaching prevention infection, watching for signs and symptoms of infection, and then watching for signs and symptoms of bleeding because of the impact on the platelet count. So just keying in on things as you're reading stuff. If you start to understand that medications do certain things to a person, regardless of the medication, you should understand what the assessment would be. Again, if it depresses the CNS system, you should be watching for drowsiness and thinking safety and fall prevention. Okay, so just keying in on some of those things. We'll talk more about that as we go through more medications. But for now, you guys have your medication sheet that you can be looking at, where you should be noting some of the most important things, looking at the practice questions that I'm giving you to see where are we keying in. When I do the practice questions, I'm really looking at other there's ATI, there's Kaplan. I'm looking to see what is out there in NCLEX books to say what are they trying to key you in on, what is most important. I will just say, because this is really one of the first videos that I'm doing for you, is it is so, so, so important that you know what you're giving your patients, okay? There's never an excuse of, oh, I didn't know that that could be an effect of this medication, right? So when you're giving medications and when you're starting out and you're working, you will get to a point, like I worked cardiac for many years. So cardiac meds, to me, I have a comfort level there because I was giving them every day, multiple times a day to patients. So when you specialize in an area or you see patients, you're going to be giving a lot of the same types of medications over and over, and you will get to know them. It's that repetition. But even I see medications, because medications, there's new medications all the time. You have to look them up and see, what is it that I need to be teaching my patient? What do I need to be assessing for? Is there a reason I shouldn't be giving this medication right now? Because I got to tell you, there are times when I've seen medications where I go, oof, this patient is on another medication that has a severe and very probable interaction with this medication. So I'm concerned about giving it. I'm going to call the provider before I give it. Okay, so protect your patients. Okay, it's not just about protecting your license, which you will be doing that too. You want to protect your patients because you do not want something bad happening to your patient because of something that you did and you gave. So, I don't want to preach that too much or scare you, but it is really important that you understand what and why you're giving a patient a medication and what you need to be assessing for after you give it. So if you have any questions, let me know. Otherwise, make sure if you haven't gone through the module 2 yet, please do that. There is the medication handout as well as a handout to follow through with the module. I am not going to do one of those for every module. I kind of have just giving you guys an idea of what you should be pulling from the modules when you're looking at those handouts. And again, please reach out if you have any questions, and make sure you're looking at the practice, any escape rooms, Kahoots, ATI practice quizzes, anything like that I'm giving you. Make sure you're doing that, because the more you're looking at questions and answering things, the better you're going to get. It's that repetition. Okay? All right. Thanks.